Hello, good afternoon. This is going to be another short lecture. All right. We have um, set a rider to this lecture from our previous classes. And I think this shouldn't be any different. We've talked about vitamins, really, right? Um, Coenzymes, vitamin B, C, the water-soluble vitamins, right? The fat-soluble vitamins, ADEK, right? Vitamin A, D, E, and K. I've emphasized the importance of these vitamins in biochemical or physiological reactions and mechanisms. For example, your vitamin K, fat-soluble vitamin, is a very important factor in blood coagulation, right? Blood clotting. You know the importance of blood clotting, right? If you, as a nurses, you should know what hemophilia is, right? When there's a defect in the blood coagulation mechanism in human body, then of course you're going to have problems, excessive bleeding, hemorrhage, which will ultimately lead to death if care is not taken, right? So that's just by the way. Vitamins, all right, proteins, you know the importance of proteins, carbohydrates, the energy, the energy provider of the cell, carbohydrate, fats, right? In cases where you have, let's say, you have some metabolic disorder and you can't use carbohydrate or carbohydrate can't get into the cell, then the body will have to use fat. But when you have excess carbohydrates in the body will convert it to fat and store it. Your fat can also be used as energy. You've seen the beta oxidation, the glycolysis for carbohydrate, beta oxidation for fatty acids, and things like that. So just by and large, that's basically what we've done from the beginning to this point of this course. Now, what about trace elements, right? Your copper, your iron, your zinc, they also play a role, right? In metabolism. They are not there for nothing, right? As much as you need coenzymes, which comes from usually your vitamins, thiamine, vitamin B1, for example, thiamine pyrophosphate comes from vitamin B1, thiamine, okay? Pyridoxal phosphate, pyridoxine, vitamin B6 is also a coenzyme in some enzyme reactions, especially in the amino acid metabolism. Now, some of these enzymes also require what we call uh, activators. And most of these activators, unlike coenzymes, are inorganic elements, just like your trace elements here, right? Mhm. So let's just dive a little bit deep so you understand what we are trying to see. Your trace elements, apart from your carbon, hydrogen, nitrogen, oxygen, which we've discussed, your carbohydrate is basically carbon, hydrogen, and oxygen. Your fat is basically carbon, hydrogen. Your protein is the combination of all carbon, hydrogen, nitrogen, and oxygen. We are going to treat amino or protein metabolism in the next module, so you're going to understand what I'm trying to say. Anyway, dietary minerals are chemical elements required by living organisms other than the four elements here, right? So now we want to talk about elements that are not these four. Your zinc, your copper, your iron, and so on. Selenium, for example, and so on, okay? Uh, like, like everything in life, you need balance. If you take adequate amount of, you take in or you consume adequate amount of these elements, they will do their job. If you take them in excess, they will cause toxicities. If you don't take enough concentration needed by the body, you're going to end up with a deficiency of these elements, right? So basically, that's what's happening here. Now we have macro and micro minerals or elements. Macro elements are required a little bit more quantity than micro elements, just from the name, right? Micro, macro. All right. So Macro minerals are required in the diet in large amounts greater than 100 milligram per day, and they represent about 80% of the body organic matter. And example of macro elements include calcium, which is required for your bone health, right? Phosphorus, potassium, sulfur, sodium, chlorine, and magnesium. All right. Magnesium plays a role in as a cofactor in a lot of enzyme catalysis. Okay. Micro minerals or micro elements, example of micro elements. The difference now between micro and macro, macro are needed greater than 100 milligram per day, micro less than 100 milligram per day. Basically, this is the difference, okay? Example include iron, cobalt, copper, zinc, molybdenum, iodine. You remember iodized salt, right? Selenium and cobalt, okay? And then you have non-essential minerals, which are found as contaminants in foodstuffs. These are examples of some of them, some of those contaminants and toxic minerals. Aluminium, silver, gold, bismuth, and lead. Key here is lead. If you remember chemistry, CD is cadmium, mercury. Okay, lead. Those of you that are familiar with the reports of lead poisoning in Zamfara, you know what we are talking about, right? Lead poisoning can even be deadly. Okay. This table summarizes everything we just mentioned above. Okay. And you have a question here. List 5 macro trace elements. These are just example. You should know, right? Because we just mentioned them above. Calcium is one of them. It's not mentioned here. They said only 5. So these are 5. Potassium, sulfur. There's phosphorus, I believe. Phosphorus is not mentioned here. Okay. Anyway, I think this is quite exciting. So this is something you could easily read and understand, but let's take our time. Trace elements. Zinc, for example, an example of micronutrients, microelements. Now, the more than 300 enzymes are zinc dependent. So it just emphasizes the importance of zinc. Example of enzymes that require zinc for catalysis include RNA and DNA polymerases. These enzymes play a role in the polymerization of DNA, the addition of nucleotide bases. Let's not go too deep. This, I think you know if you've taken um, uh, metabolism of nucleic acids, okay? Alkaline phosphatase, an enzyme that removes phosphate groups. It requires zinc, carbonic anhydrase. It's another enzyme. It also forms what is known as zinc finger. This is real biochemistry, okay? But just keep this in mind. Zinc is also involved in DNA and protein synthesis, as well as transport of vitamin A. Of course, we've treated vitamin A in the previous session, right? The two groups of vitamin A, the retinoid group and the carotenoid group, right? The carotenes, okay? Taste perception, wound healing, it plays a vital role in fertility in males. So some of the food, zinc is important during pregnancy for the growing of fetus, whose cells are rapidly dividing. Zinc also helps in avoiding congenital abnormalities and preterm delivery, okay? So you can get zinc in foods like meats, shellfish, poultry, whole grains, vegetable, cheese. Basically, rich protein, foods that are rich in protein, just like the ones we've seen here. Not all, of course, but what's the recommended dietary allowance for zinc? 11 milligram for men, 8 milligram for women. And the deficiency can cause poor growth and impairment of sexual development. If you take too much of it, there's the issue of toxicity, which include toxicity effects would include loss of appetite, impaired immunity, and decreased high-density lipoprotein cholesterol. This is good cholesterol. You need this cholesterol. You don't need LDL. If you have too much of LDL cholesterol, that's bad for you. That's what might lead to vascular complications, your cardiovascular diseases and things like that. Okay. Um, Toxicity due to zinc can also cause iron and copper deficiencies in the body. Okay. All right. And this is commonly seen in welders because they inhale a lot of zinc oxide fumes. All right. Okay. Then we talk about iron. You can just take your time and read all this. Okay. Yeah. So I think this chart here summarizes everything you need to know about iron. Okay. It's very important. It's an important component of hemoglobin, right? Hemoglobin is found in your red blood cells, right? And it carries oxygen around. So basically, when you inhale oxygen, it goes into your blood. It's carried by hemoglobin. Hemoglobin requires iron in this form, ferrous iron. But the storage form of iron in the blood, in the body, is ferritin. And ferritin is in the Fe3, the ferric form here. So iron plays a significant role. It also plays a significant role. This transferrin is an iron transporter, a protein that transports iron. Uh, it's required by this. So basically, this chart summarizes everything that's presented here in your course material. So I think as you are reading this, you can make reference to that, and it basically summarizes everything. Okay. Transferrin receptors are present on most of the body cells, especially on cells that synthesize heme. Of course, they are important because heme requires iron, right, in the ferrous form. So the iron will be provided in the ferric form, will be converted, reduced to the ferrous form, which is going to be used by heme because it requires it to give it its full structure so that it can carry oxygen around from your blood to tissues of the body, which will require this for aerobic catabolism, just like your glycolytic and TCA cycle, right? Without oxygen, aerobic TCA cycle is not going to happen, all right? So your RDA for iron for men is 8 milligram, yeah, and then for women, uh, 18 milligram, depending on the age, of course. All right, these are food sources where you can get your iron. And deficiency of iron, of course, since it's required by your blood cell, RBC. Of course, deficiency will cause anemia. That's obvious, right? It's very obvious. Deficiency will cause anemia, among in addition to a litany of other. Well, the toxicity, if you have too much of it, will cause gastrointestinal distress, infections, fatigue, joint pains, skin pigmentation, and organ damage, just like you can see here. This is pigmentation. This is iron deficiency anemia. And copper, okay? Total body copper is 100 milligrams. It's found in muscles, liver, bone, marrow, brain, kidney, hair, heart, and hair, okay? So there are enzymes that require copper-containing enzymes such as cytochrome oxidase, which I think you should remember is found in your electron transport chain, mitochondria, right? Inner membrane. Tyrosinase, peroxide dismutase, ceruloplasmin. It is required for iron absorption. So iron metabolism requires copper, really. So they go hand in hand, an incorporation of iron into hemoglobin. Okay, now you remember hemoglobin, right, in your red blood cells. Hemoglobin is a protein. Heme is a component of hemoglobin. Heme is not a protein, but it's a component of hemoglobin. And the heme requires your iron in the reduced form for chelation. form the basic structure that will help hemoglobin take up oxygen. Okay. So only about 10% dietary copper is absorbed. Excretion is mainly through bile, right, from your liver, you remember? Gallbladder, is it liver? I'm not sure. Please, as nurses, you should be able to tell me. Sources of copper, legumes, nuts, seeds, whole grains, organ meats, just like your liver, okay? Drinking water. So since it's copper is intimately, activity of copper is intimately linked to iron. So of course you should think of some kind of anemia if there's a deficiency of copper, right? And this anemia is called microcytic pneumochromic anemia. Cardiovascular diseases, there's a risk of that, and so on. Toxicity could occur from eating acid foods, cooked in uncoated copper cookware, or exposure to excess copper in drinking water. All right, and this could lead to copper poisoning or Wilson's disease, vomiting, hypotension, coma, GI distress, and so on. All right, this is Wilson's disease, copper deposition in the eye. Fluoride, you don't need to say much here. Fluoride is present in your toothpaste, right? To prevent caries, tooth decay caused by Streptococcus mutans or other streptococcal pathogens of the mouth. All right. Um, Toxicity, of course, if you take too much of it, there's a consequence, right? Selenium. Okay, selenium is another uh, uh, trace mineral. It's required by glutathione peroxidase. It's an important selenium containing enzyme. What does this enzyme do? Please find out. Okay. Iodine, iodized salt. Why did the Nigerian government feel the need to uh, fortify our salts with iodine? This is because deficiency of iodine causes goiter, enlargement of the thyroid gland. You should know, right? So I think the country has done a good job in this regard. Most of our salts, let me see all of our salts. Let me dare to see all of our salts are fortified. Okay, so basically this is the end of this class. It's quite straightforward. Take your time, read the lecture note. If you have any questions, please post. And this will mark the end of module 2. And then we'll go in on module 3. Try to see if we can finish this course by the end of this week or early next week, hopefully. I think I'm going to drop a group assignment this week. And by the end of this week, we should also drop an individual assignment. Let's start wrapping things up. Okay? So if you have any questions, you can please post in the forum. Thank you.